We all know that the entrepreneurial spirit is alive and well, not just outside government walls, but within them as well. We have Todd Park here, who is Chief Technology Officer at the Department of Health and Human Services.
Hello.
Welcome.
Thanks so much.
Well, it sounds great that HHS is recruiting entrepreneurs and really getting new, fresh ideas, but what is it really resulting in?
It's resulting in HHS thinking very entrepreneurially about how to spur entrepreneurship outside HHS to innovate and transform healthcare. One fundamental principle of how HHS is approaching health reform is that HHS isn't going to be the agent that transforms American healthcare. HHS is simply trying to position itself as a contributor to conditions that will enable market forces and private sector innovation to change healthcare.
Okay.
So as an example, a couple examples. One play that we're executing under the Affordable Care Act is to change the incentives in terms of a Medicare payment from pay for volume of service to pay for health and quality.
Okay.
Because it's very, very hard to scale innovations that improve health and quality if the payment system doesn't pay for it. In fact, the payment system kind of punishes that, which is what fee-for-service really does. So Medicare, as a big payer, is, under the Affordable Care Act, morphing how it pays from pay per service to pay for improvements in health and quality. And that will be a huge enabler of private sector innovation to improve health and quality.
Okay.
And on another front, we've been engaging in a campaign of what we call data liberación. So we've started this initiative called the Health Data Initiative, where we're essentially turning HHS into the NOAA of health data. By NOAA, I mean NOAA, the National Oceanic Atmospheric Administration, which is an agency that, until I joined the federal government a year and a half ago, I never knew this. They collect a ton of weather data in America. And then they take this data and publish it in machine-readable form, downloadable, online for anyone to get for free without intellectual property constraint. That data then fuels private sector innovations like the weather.com, weatherspark.com, Weather Channel, iPhone weather apps, weather insurance. Innovations by the private sector that actually generate a huge amount of social benefit powered by this data. Right?
All right.
So to us, that's just a brilliant kind of jiu-jitsu play, right? Take a bunch of data that taxpayers have already paid for, right, and publish it for anyone to pick up for free to power a whole bunch of innovations that create big social economic value. So we said, why can't we do that, right? Because we've got Medicare, Medicaid, NIH, FDA, CDC, tons and tons and tons of data sitting in our vaults. So we've, over the past year, been steadily publishing more and more of this data and promoting it to the innovators across the country who've been turning it into a growing array of new products and services and features, companies that take the data and build useful services and applications for consumers, for doctors, for hospitals, for employers, et cetera, creating a lot of social value and increasing economic value at the same time. And so again, both of these are examples of how HHS isn't going in and sort of restructuring medicine itself, right?
Yes.
But rather helping to create conditions, right? Incentives that focus on health and quality and liberate information that collectively comprise rocket fuel for private sector innovators to take that rocket fuel and turn to innovations that improve health.
Okay, so what's the incentive really for these innovators to come in and do this under the guise of working for a federally mandated program?
Oh, yeah. No,
versus
actually,
just going to the private sector and maybe marketing it right away.
No. So just to be super clear, the entrepreneurial activity that we're enabling with this incentive change and information liberation is all in the private sector.
All right.
All in the private. So the government's not building apps for consumers or for doctors, right? We're just liberating information and helping to create incentives.
To provide the motivation to get them
but they recruit an entrepreneur like me, and they're recruiting a small number of entrepreneurs, right, to help do this kind of work, to create conditions that help encourage, promote private sector entrepreneurship, because it's the private sector entrepreneurs that are really going to transform health and healthcare. They're just interested in the perspective and the DNA of people like me to help inform how they're doing this.
And now that we have guidelines for the accountable care organizations too, will that provide even more
That's part of the incentive
information?
Change. That's part of the incentive change, in the sense that accountable care organizations are one of the multiple Medicare initiatives that are morphing how Medicare pays from pay for volume to pay for value, pay for health. And thereby create fertile ground for innovations to spring up that help providers improve health and the quality of care delivered.
Makes sense. Now that we are clear that President Obama will be running for another term, will there be any distraction from this mandate to create entrepreneurship within the Obama administration and then shift his attention elsewhere?
Not at all. I mean, the vast bulk of people in the federal government, aren't involved really in anything other than just executing what we're supposed to do. Right? And so,
are you encouraged by everything you've seen so far?
Oh, it's been unbelievable. So my background is I'm a private sector entrepreneur. So the past year and a half, as HHS CTO has been my first experience in the government. And I'll tell you, it's been the most entrepreneurial experience I've ever had.
Okay.
Incredibly fast-moving.
Fantastic.
A lot of breakthroughs, a lot of incredibly dedicated people working incredibly hard to try to be helpful. And again, not trying to physically transform the system itself,
yes.
right, with our own hands, but rather helping to create conditions and remove barriers to market forces and project innovation in healthcare that are really what's going to transform health and healthcare in this country.
Yeah, and could possibly really initiate change on a massive scale.
Oh, yes, absolutely. Actually, the stuff I've already seen start to spring up in the private sector in terms of new innovations and new companies and new angles of care delivery. The stuff I've seen is just stunning. It's just stunning. And I think that what we're going to see over the next 5 years will just boggle the minds of everyone who doesn't believe healthcare can change. Because I think that at the end of the day, if you've got the right incentives and if information flows freely, right, the market is taking over and will drive change with a speed and a ferocity that will stun people.
All right.
And I think that trajectory has already begun. I think our path along that trajectory has already begun. And it's really, really exciting to see.
Okay. Well, Todd Park, thanks for stopping by.
Thanks so much for having me over.
Thank you. Great to meet you.
Great to meet you.
I'm Mabel Jong. Thanks for watching our coverage of World Healthcare Congress, 8th Annual.